Hi, welcome to the KRON4 Web Chats. I'm Janelle Marie, and you may recognize the gentleman sitting to my left, Dr. Stanley Jacobs. He has been on the KRON4 airwaves for a while, and so you may recognize him. He is from the Jacobs Center for Cosmetic Surgery. You are the founder of the Jacobs Center for Cosmetic Surgery, mainly in Healdsburg. So welcome to our Web Chats.
Thank you.
We've got the beautiful view behind us.
I know, it's awesome.
It's awesome.
Very happy to be here, very glad.
Yeah.
It's really exciting. It's our first Web Chat, so.
Yes.
And, you know, we do have an office in Union Square, but
Yes.
which is our satellite office, and it's great. We can see patients, but we are located in Healdsburg, and yes, we're not destroyed. The fire didn't touch anything in Healdsburg,
That's
the town.
good to know.
So business is still going on, so
That's
everybody
good.
come up to Healdsburg, to the wineries
Yes.
and restaurants and our facility. I mean, I took this picture yesterday of our facility, so, you know, it's still
it's all
standing.
there. That's
You
good.
know, it's still great.
Well, I want to mention also before that we are starting a little bit early. So we've got lots going on. We got Dr. Stanley Jacobs, and he's going to be talking about facial cosmetic surgery. So I want to talk to the Facebook viewers right now and let them know if they have any facial cosmetic surgery questions for you, to give them to us now, because we need your questions. This web chat is about the people behind the camera and questions for you. I've got questions here. We're going to talk, but we need those questions from the Facebook viewers also. So bring those questions right now, because we're going to be here for a while. You have two patients that are going to come in we're going to talk to, so this is going to be exciting. But let's talk a little bit about your background, a little bit about yourself, about your background, and, you know, just refresh the viewers.
Oh, first thing, I'm a big Sharks fan.
Oh, well, there you go.
I had to get that
and we're done.
Yes.
Thank you.
We're out of here.
We're gone. And they're doing well right now.
They're
so
doing
you're
great,
happy.
4 in a row, yeah.
Well, you're Canadian, so you're a big hockey guy,
I'm a big
right?
hockey guy. I still play in Santa Rosa, yeah. So the facial, the Center for Cosmetic Surgery, I'm a facial plastic surgeon, and I did my fellowship at UCSF years ago. So we have a strong connection to the Bay for sure, and that's why the Union Square office. But, Culbertson of our team, and he's the breast and body surgeon, and he will hopefully come on a little later.
Dr. Eric Culbertson.
He's
on the website.
And we have two patients who are awesome today. They're coming on. They're so graciously said they were going to volunteer to come on.
We get the real before and afters from Trish and Jennifer.
Yep.
So that'll be very exciting.
That'll be very cool to see that. And I've got, you know, everybody wants to see before and afters. I've got a stack of those.
Oh, and your website is thejacobscenter.com. So if you want to see before and afters, if you missed any part of this,
we have a ton of them.
Yeah, go to
There's
KRON4.com or thejacobscenter.com. We've got all kinds.
Yeah, you hit the gallery and you'll see a whole batch of pictures.
A bunch of them, absolutely.
Yeah, so because obviously that's important. People want to see that.
It's hugely important. People want to see that.
Want to see that, and so the idea today was to really ask people. You know, you call in, like you said.
Yeah.
Get your questions. Sort of everything you want about plastic surgery for you to ask.
Yep.
You know, kind of thing.
We've got him right here.
And
so please ask those questions. Anything.
And we're happy to do that from anywhere from Botox, fillers, cool sculpting, hair transplants, facial surgery. We're going to talk about
hair transplants. That's huge.
And breast augmentation, whatever. So we're here to kind of talk about that. And the first thing I want to let people know is that, you know, it's very important that, yes, I'm triple board certified, and Dr. Culbertson is board certified plastic surgeon and fellowship trained, but is that we really want to care for patients. We want them to feel comfortable. We talked about this earlier off camera about, you know, really caring for people and making sure that they understand that, because I've been doing this for 30 years, and I've operated on probably 15,000 people and procedures, and it's important for them to know it's not just about doing the surgery, it's about taking care of people. Because the doctor-patient relationship is the bond that holds us together. It's what really makes it a special kind of a unique situation, right? I think that term doctor-patient relationship is sort of thrown around, but it really, we have to take it very seriously, that bond. And the whole Hippocratic Oath thing, which is, I still have that document in my wall. Oh yeah, it's fading a bit. But so, you know, that's really important, the experience of the patient. Yeah. We're going to talk a little bit about procedures and get into actual experience, but we're also going to maybe also mention that obviously the outcome's important. So what's our philosophy? Because I think it's important for people to understand a philosophy, and therefore, you know, how we think about plastic surgery. Right. I think about it, in Dr. Culbertson, in a very natural way.
Good.
How can we make people look as natural as possible?
Look like themselves.
Look like themselves,
Absolutely.
but better.
Yes.
Because, you know, I really believe every face has beauty in it. Every face has attractiveness if you're a guy or woman. And our job is really to bring out that attractiveness. It's not to detract from that. So part of our job is not to say, okay, I don't like this, I don't like that. The patient says, you know, we get that.
Right.
But what is so lovely that we can kind of make that part stand out.
Exactly.
When I do, say, a rhinoplasty, patients look at them and go, oh, your lips look better, your eyes look better. Didn't touch them. But it's because it fits together.
And it wasn't so, you know,
wasn't so obvious.
oh, you had your nose done.
Right. And so that kind of thing is very critical to us, but it doesn't happen easily. It's a lot easier to do something that looks obvious than something that looks very beautiful and subtle.
Exactly.
So, you know, I've been fortunate. I studied actually art and aesthetics all my life.
Wait, I've got a quote from you. Beauty of the fine arts can be applied to aesthetics of facial plastic surgery. That was from you. Yes. And that's what you're kind of talking about, right?
Yes,
How it's not just lifting a face,
right.
It's actually the art of it, and that's what you specialize in.
Right, and and I believe that. I really, you know, I've studied human faces and art for, well, most of my life, and our job is then to say, instead of saying, there's a procedure called a facelift or a rhinoplasty or whatever lift or something, is say, instead of that, say, what does this person want? What do they need? What makes sense for them? Explain the options, and then say, how can we use procedures that we have to work for them?
Yes.
Not just ka-jung, ka-jung, you know?
Exactly, not just boom.
No,
lift,
not as cookie
pull,
cutter.
No.
So then it's our job as surgeons, right, to then create and modify our techniques, our basic techniques. It's like saying, here's a palette of paint, and you can paint whatever. If you're a great artist, you're going to take that and paint some really amazing things, right? Not just, okay, I'm just going to paint. So the idea is the same idea.
Yes.
Is how do we make it so that it really looks beautiful and natural? So on our website, we've got lots of things.
thejacobcenter.com.
About, like, for instance, I call it a technique called my vector lift or serial vector facelift. There's artist drawings about where the stitches are, what's actually happening under the skin to lift, the, say, the fascia, which is the connective tissue, rather than just pulling skin tight. So we have to have the techniques to match that. And that takes some time.
And it's different with every person, and that's why you're special, because you take every person, not just, oh, another facelift, boom, done. Right. I mean, you have to take their bone structure into consideration and everything, right? Because it's different on every patient. So you have to have that artist eye to know, if I do it that way, that I did it the last patient's way, it's not going to work.
And that's right. And that's the other thing about, you know, really studying patients year after year, month after month after year, because if you do that carefully and look at, because what I do is I'll look at the before and afters later, and I'll go, you know, could I have done that a little bit better? What could I have done to tweak that a little bit better? And if you do that for every case, after hundreds and hundreds of cases over years, you're going to get, you know, you're going to get really good. And so basically, like any surgeon, right, we should be, what we're doing today is built upon all those cases you did beforehand.
Exactly.
And that experience to use that. So we shouldn't forget what we've done, obviously.
No,
we want to build on
it.
And that's really important too.
And now we're starting to get questions, but this question is a good one, but I want to wait because we want to talk about first just the facelift first, because the question I'm getting is, what is the downtime for mini facelifts? We're going to get into that because that's kind of the new techniques coming around, but
next.
Let's just kind of talk about the old school facelift, you know, so downtime for that and stuff. Are you still doing a lot of those? Is it more the new techniques? Let's talk about the old school and get that out of the way.
So, you know, it's not really old school. I would say it's just, again, for each person. So some patients who have, you know, a lot of loose skin, a lot of loose fascia, maybe extra fat, maybe their brows are low. There's a number of things going on.
Right.
And it's not just they have a little sagging of the cheek or just a little neck looseness.
Right.
So then you have to do more surgery, right? Again, so in that case, maybe they need an eyelid lift or a brow lift plus a facelift. And so just to kind of give people a sense of facelifts, the incision where you make the cut, right, goes around the sideburn to preserve your hair so it doesn't change.
Yeah.
And you won't see that. And then it goes around this thing called the tragus, which is this little piece of cartilage, so it's not in front. And then behind you into the hair. So even if you have no hair like me or very little hair, once it heals, you can't see it.
Can't see the scar at all.
You want to make it, I call it like the California coast.
Yeah.
Irregularly irregular.
Half Moon Bay.
Yeah, you don't want a straight line. There's no straight lines in nature, so there shouldn't be straight lines when we do surgery. So that whole sort of serpiginous, you know, curve to follow the curves of an ear and the hairline, make it look natural. Now, why do we do that? We do that because we want to use that as access to get to the underneath layer.
Okay.
So there's skin, fat, fascia, the key one, then muscle and bone. And patients are sort of dumbed down a lot of times to the doctors and say, we're going to tighten your muscle. We're not tightening your muscle because we did your muscles, you'd be like, it would
That
look
would
right.
be, yeah.
That's bad. But they don't think they understand the word fascia. Well, they do. People are smart. If they can, kids can understand Dumbledore, you know, Harry Potter, they can understand fascia.
Harry Potter fan also.
So, well, I'm just saying, you know, why?
Hockey, Harry Potter.
I got kids, you know,
That's
I still read to them. But you know, but it's important that people understand the reality, and but if you explain it to people, because fascia has good tensile strength, meaning it's strong. Skin is pore strength. So if you just pull a face, use the skin only,
the skin, it's not going to work.
It's going to sort of break down and slacken. But if you pull fascia, baby, that's strong.
That's
it's going to lift. And so what we do is we access the fascia by those incisions to get to certain points. Obviously, the jowl is the loosest part of the face. So that's where I actually start sewing from here and working my way back up. So with underneath little tiny stitches to put the fascia back where it came from.
I like that.
That's the key.
Yes.
Put it back where it came from. Thank you very much.
Anywhere else.
And then you don't have to pull the skin tight, because if you don't do enough fascia lifting, then you're like, maybe I should pull the skin tighter. That's when the trouble happens. So we don't want that look. We want to create a natural look, but that's how we do it.
That's just the normal facelift.
That's a facelift with underlying
the real one,
work
the
on the neck. And
And what's your downtime for just a big
2
facelift?
weeks.
2 weeks. That's good. And you put the drains in, so people after...
No drains.
No drains.
No, I put in drains only in men, and I'd say 1 in 10 men. That's
really?
It. No females.
That's fantastic.
No, so look, this is part of the whole thing about surgery. This is a general kind of comment. Okay. Because I did training in cardiovascular thoracic surgery and bypass and everything before I went into this, and I'll just tell you, generally speaking, about surgery, it's about being delicate.
Yeah.
And Dr. Culbertson will echo this, because I've watched him operate. We're operating together, but I've watched thousands of doctors, obviously, is that you have to be delicate. You have to be respectful for the tissue. If you're respectful for tissues, it's going to heal really great. If you're getting in and you mess around, there's going to be more bleeding, more problems, more complications.
I like that.
You don't want that. You want to kind of get in, it's like stealth, and get out as though it didn't even know you're in there.
I like that.
It makes a huge difference.
It does.
You know, cells, I even did, when I did a master's degree in research, you know, I worked in a lab with cells. If you shake them a bit, they won't survive. That's a cell, never mind a human body. So that tells you that we need to be very delicate. So, because people say, well, gee, my friend had surgery and she was bruised for, I don't know, 3-4 weeks or something. I said, how come yours doesn't? Well, you got to be gentle.
And does the patient for a facelift have to prepare a different way?
Well, yeah, I mean, for all our surgeries,
for the big facelift, I mean,
any surgical procedure, or even honestly for some of the injections, you need to not be in a blood thinner 2 weeks ahead.
Okay.
No aspirin, no ibuprofen,
no Motrin,
no fish oil. So those are blood thinners. So if you don't do that, then the chance of bruising is going to be less. After surgery is important, so you take it easy, head elevated, ice a lot. Those are the key things.
And we have a question here on Facebook. How long is the surgery?
So
this is for the main facelift we're talking about right now.
That's about 2 hours.
2 hours for the main. And they're talking about general or local. I know we're going to talk about that, but for the big facelift, what is it, general or local?
General. Okay. Yeah, you can do it on a local. You need sedation or an actual general aesthetic, but works out to about the same thing. And just quickly, here's a picture of our surgery center
that's
in
right.
Healdsburg.
That's right.
This is the reception, but the bottom's the operating room, and you know, it's a AAAC accredited facility, meaning that it's like the same accreditation as hospitals will have. We have JACO. So it's very safe, but so you can have an anesthetic. The recovery is about 45 minutes to an hour, and then if you're living in San Francisco and you have surgery in Healdsburg, we put you up in a hotel.
Oh, okay.
We cover the cost. You stay in a really lovely hotel down the street. You then come back the next day for a dressing change, and then you go home.
And the nice part about the surgery center is it is less expensive than a hospital.
Yeah, by about 1/10.
Your team is so great that, I mean, you just have Dr. Jacobs' team around you.
Yes.
So you don't have to worry about hospital staff or anything like that. It's a lovely team.
It's like having the A team every day.
It's like having the A team every day. It's like having the best hockey team around you every day.
Thank God. No, it's true, because that's the thing. I mean, I was chief of surgery at Memorial Hospital in Santa Rosa, and I, at Sutter and stuff. So I know what it's like to work in a hospital setting. Obviously, if I did it for years. But what's great about this is, even if I had a lot of pull, I couldn't always get the people I wanted because that shifts.
Exactly.
But I can get everybody I want every single day. And knowing them and knowing each other and having that team of my anesthetist, 15 years, my scrub nurse, we're joking that the three of us have like 75 years of experience between us. But it's the experience, but also there's an interchange.
Yes.
See, I want to make sure all our staff, we always tell them, look, I want to hear your opinion. You count. You're part of this team.
Absolutely.
It's not one of these top-down things at all. It's all like level playing field. So we all get to be part of the team, and then that way it's integrated, so everybody's really caring about every aspect of the patient care.
And along those lines, I have a Facebook question. What is the process of making an appointment? How long would it take to get in? Because a lot of people think, oh, I can't get in there. That's going to take way too long.
You just call the phone number, that one.
Oh, and by the way, let's transition into that phone number, because aren't you giving away Botox?
Oh, yes.
And we're going to bring Trish in a minute, but I mean, we can talk about this forever. It's great. Here's the phone number, 415-433-0303, 415-433-0303. First 3 callers gets a vial, a syringe. I was going to say vial. Free syringe of Botox.
Yep.
That's awesome.
That's for big, cool customers. Thank you very much.
And can Botox help with headaches? I got a Facebook question here. Can Botox help with headaches?
It can, but we don't focus on that.
Okay.
That's a whole different deal.
Okay, and then so it's not a big deal to make an appointment with you. People will get in.
Yeah, sure. We'll make sure they come in. We'll, that's the thing. That Kayla is actually waiting on the phone to talk to people.
Oh yes, Kayla will be the person you will talk to.
And she's awesome.
415-433-0303.
Yeah.
Now we talked about the big facelift. We want to transition to the new techniques now, because people think, do I have to go in and just only get a facelift? No, you can go in for smaller techniques, preventative care, so you don't have to go to the big facelift, correct?
Correct, but just quickly before I get to that, I kind of, oh, here's another picture of our office, but that's the going upstairs.
Beautiful. And the the office.
So these are some patients, just before I get to the smaller procedure, who had
good.
Bigger procedures. So this lady had a facelift and a forehead lift. That's about 4 weeks later.
Okay.
You can see her better jawline, neck, and eyebrow area.
Very, very nice.
And very natural. And that's the key. And this lady had a facelift, and again, she's about 4 weeks. But the key is, if you covered this picture before, it wouldn't look like if you saw her that she had surgery.
No.
That's the key.
That is
but
the
if
key.
you see the before, it's like, okay. And this lady, of course, had tremendous sun damage. She had this is a year after. Facelift, a chemical peel, you could see the change of her skin texture with the chemical peel with the facelift and forehead lift. So
do you know what you're going to combine when you do a facelift? You know that maybe you're going to use fat transfer, maybe you're going to use chemical peels. How does that all work?
So actually, I don't do many fat transfer.
Okay.
We do some.
We did have a question about that.
Yeah. Well, my personal feeling is that if you can take somebody like this who's very saggy and loose and use their own fascia to rebuild their face.
Right.
You don't need to add anything.
Good.
So it's less cost, short another procedure, and we're using their own tissue to has a blood supply. When you transfer fat, it's fabulous, but it has to acquire a blood supply. This already has a blood supply, so the take rate is perfect.
Good.
So I'm about creating my techniques to use their own tissue.
Okay. Okay, good.
And this is another lady. Now, she had a rhinoplasty, no surgery, and a facelift.
And a facelift, okay.
At the same time. And an eyelid lift, you can see her eyes look more open.
Yes, definitely.
But again, you're looking at the balance of the face.
Very natural.
Natural look. So that the nose and the neck and jawline all balance, and that's the kind of thing. So those are kind of the more, bigger, if you want to call them, regular kind of facelifts.
And men also come in for the procedures as well?
And we have some men coming in, and here's a guy that we did.
Full facelift?
Eyes, full facelift, too.
And so Downtime, when you can go out and start working again after you have a facelift?
Working out's about a month.
Working out is a month, and so going to work is 2 weeks, you say? Like
yes,
just
because basically people want to know when the bruising and most of the swelling's gone. That's what they want, right?
Exactly.
And it's about 2 weeks. And women, of course, are great with makeup, so they have longer hair, so you can hide things better. Although this guy here is very short hair, he went back to work and nobody really knew he had surgery.
That's great. Very natural,
Natural look. So those are kind of the regular kind of bigger facelifts, so we need to do a little bit more work.
How long will a facelift last? Just wondering.
8 to 10 years easy. But this is a cool thing to remember.
Yeah.
So, because people say, well, what happens then? Does it fall apart? No, of course it doesn't. But say you had a twin sister, and you had surgery, she didn't.
Yeah.
You go back in time, you look really good, right? Well, you both age.
Yes.
But you never catch up. You always going to look better.
No
matter what.
That twin better get in.
Better call her.
Yeah. 415-433-0303.
Oh, good.
Or just go to thejacobcenter.com. Also, remember, for before and after pictures, and KRON4.com. If you missed the first part of this discussion, you can always go to KRON4.com and get it. Bring your questions in to Dr. Stanley Jacobs. We've got him here for an hour or what? You need to bring these questions. We got a lot of questions coming up, too, but Let's talk about new techniques now, and smaller techniques and preventative techniques, because I'm getting a lot of questions about that kind of thing. Mini facelifts and stuff. What is Downtime for that?
That's become a really big part of our practice, the smaller procedures and the local anesthetic. So what does local anesthetic mean? It means you put the injection of local, but it's not like going to the dentist in a sense, because we give them a Valium, we give them a pain pill, tramadol or whatever, give an antibiotic, and they chill out. You know, first, like I was joking, you know, they look a little bit like that, and then I walk in and they're like this. You know, they're like pouring them off the seat. Then you know they're ready. And you put, you know, we have a nice OR, we're credited, so put on some music, Sade, I don't know, whatever, and make them comfortable. But then the type of injection, we talked about this, how you inject local anesthetic is really important. Because you don't want to sort of inject randomly. You want to go behind the same part you inject, so like a little wall, so it pushes the anesthetic forward, so it doesn't sting as much. So they hardly feel the local.
Wonderful. And there's not as many.
It's not as many.
Like that.
And then you wait till it really numbs up, and then the music's going, and by that time now the meds are kicking in. You do the procedure, like, oh, you're done?
You're done,
So that's really, really important to, again, to care for the patient and talk to them. How you doing? What's going on? How do you know, that kind of thing. So the mini procedures are really popular. Mini facelift, mini lifts, mini cheek lifts, mini neck lifts.
I didn't know about the mini cheek lift. That's new.
Mini cheek lift's pretty cool. So, you know, a lot of people say, well, gee, you know, I need a little, some filler or something to lift this up. Unfortunately, putting fillers in your cheek actually will lift your cheek. It'll give you a little more volume. What only that actually lifts your cheek is a mini cheek lift, which you can make a little incision just in the hairline, tunnel, and go here, tunnel down, put those stitches in the fascia, lift the cheek up, remove some skin, put some stitches.
That's it?
45 minutes, local, done.
Really?
And that'll last you several years.
Wow.
So that is a really great procedure. Somebody says have a little loose in the jowl, then you do like a mini lift just in front of the ear, local anesthetic, put in stitches in the fascia, tighten the jowl, done.
And what are so downtime's not a big deal for that?
A week, maybe.
And so not a lot of bruising if you don't take your blood thinners.
Don't take blood
and whatever
thinners.
for
You're
about 2
healthy.
weeks.
Don't take a, you know, make sure blood pressure's okay. No smoking, people.
No.
That's not good. So, but if you do these small procedures, and I even do mini neck lifts, so the incision's behind you, you don't even see anything. You go back to work really fast.
Now, there's a lot of facelift women, men that go in, get their facelift, but they forget about the neck. A lot of people forget about the neck, and that's a huge issue.
Oh, the neck is huge.
Neck is huge, but why do people forget about it then? It's just...
Well, because I think that people, if you're not, you know, I do only faces, right? So I'm focused on all these areas. Some people say, well, gee, you know, we're just going to do the cheek today and we'll kind of leave the neck alone, or I don't know, whatever. But it's very important. In fact, I would say for facial procedures, neck is
the most important,
huge,
right? Yeah.
Because that's what loosens first, right? Our skin here is in this.
So especially on women.
If we do this,
the neck is.
You can make somebody look so much better, youthful from a neck lift. So yes, it's a big part of the practice.
Yeah. And should we bring Trish in?
I think it's great. Time. Come on in, Trish.
And we're going to bring Trish in. She is a patient of Dr. Jacobs. And remember, ask any questions because we have them for a good hour or so. Ask questions, please.
So happy to be here.
All right. Hi, Trish.
Hi there.
Now, Trish is a patient of Dr. Jacobs. Remember, you just go to thejacobscenter.com. You can see all the before and after pictures. You can call 415-433-0303 for an appointment, or you can go to KRON4.com and see this also for a whole year after. So if they miss anything, hi.
Hello.
So are you okay standing up?
Oh, that's fine. Yeah, that's great. So this is Trish. This is one of your patients.
We've known each other for a long time.
Yeah. Okay. Good.
And Trish is an awesome patient, and she had surgery under local anesthetic, a small procedure, about 2 months ago.
Okay.
And so she had a temple lift here because the lateral brow was a little low, and it helped this whole area. So go ahead.
Yeah, no, what I wanted to say was that I hope it's okay if I talk about the 30-year-ago surgery that you did for me, because I had an asymmetrical wrinkle that I've kind of chased basically my whole adult life.
Wow.
And he gave me a tendon tightening procedure, which helped a little.
Yeah.
And but I was never very happy with the whole look. But
was that for underneath the eye?
I still have it. It's kind of like right here. But
Yeah.
I've done so many things now that, I mean, like you were saying before, you do one procedure and suddenly your whole face is, you know, in harmony.
Right.
So I really feel that I have made several steps, and Dr. Jacobs has helped me so much.
Yeah.
And I don't know if I ever told you how much I appreciate your believing in me, because really so many surgeons would say, well, I don't see what you're talking about. And I kept getting another opinion, and I kept going back, and he kept taking me back. And so this last time he did the little
temple lift.
Temple
See,
lift.
I didn't even know about a temple lift either.
And so it has brightened my eyes. It has tightened my skin.
Wow.
And I see this less and less all the time.
Oh,
and
yeah,
I
yeah.
do want to go back and have a, I don't know what you call that,
The
cheek
one,
lift?
because I think it's going to help even a little bit more.
Yeah.
And I see it, probably nobody else sees it, but you know, we're all insecure about our own appearances, and if there's something we can do, we like to do them.
Absolutely.
So yeah, that was 30 years ago, and it's sort of been a continuum. And most recently was
the
this
temple,
lift here,
just
and
2 months ago. Okay.
and at the same time, I got a chemical peel, and it just kind of tightened everything up. I had a little bit of flaking and peeling for a week or two, and then I don't think anybody could even tell.
Yeah, let's talk about the chemical peel real quick. So does that burn the top layer of the skin off, or did you do the major one where you have to put the goop on your face after, or how do you do that?
So it's called TCA, and basically the outer skin just dies. And so when it falls off, it is two phases. One, the dead skin falling off, which is what you see, but then your skin looks amazing underneath, right? Because it's beautiful, and it's way easier than a laser. I love TCA chemical peels. I've been doing them for many years. It's easy. There's no oozing, nothing.
Oh, that's good.
And it's just dead skin falls off, and then it's fresh skin. But the biological part of it is that it stimulates the cells to make collagen and elastin over 5 months.
Oh,
so
that's
every
good.
month it gets
That's
tighter and
so
tighter.
and I have really seen that now, because
Have you?
it's only been 2 months, but
Yeah, I know.
I can already tell
tighter.
that
You can already see the
and
tightening
plus,
effect.
You haven't done this yet, but I'm embarrassed to say I have not used this before.
What is that?
This is Dr. Stanley's Viscoelastic Transforming Serum, and let me tell you, I should have been using this all along. I just tried it yesterday.
You can just put that over here. I'll save it for you.
This
I
is
forgot to tell you
I'm
that.
just kidding.
This is like I mean, not only,
You get your own, don't worry.
Yeah. Oh, good.
not only was my skin like very, very soft, but I could feel it tightening.
Oh, really?
And
That's
it did last
nice.
all day long. So anyway, yahoo! Cool. And then was there another?
Well, what was your experience like?
Wait,
Oh,
before
my God.
that, I just want to mention the Botox offer. 415-433-0303. First 3 callers get a syringe of Botox. We're talking about facial
Okay, while
cosmetic
you're
surgery.
talking about Botox,
Yeah.
I want to just jump right over to the,
Please do.
what is it called? The Juvederm.
Oh, yeah.
That Dr. Culbertson put in my
Underneath the
ear,
eye?
the same wrinkle. I have never had that kind of result. I'm like, he got it dead on. It's so much better. And so in addition to the peel and this, which brightened my eyes, I'm like, okay, I'm pretty darn happy for 60. So
That is fantastic.
It was very,
Oh
very,
my
very
gosh.
nice. So that, and then did you ask me another question that I've
What your
completely...
experience was like.
Oh
Yeah,
my
the
gosh.
experience.
Okay.
Because that is key, right?
No,
to
well,
a patient,
yeah.
you want those.
No.
Tell
So
us.
we have Dr. Stanley Jacobs, who is a total, real, live person in there. I mean, you would think he would be this person that you have to bow to, but he's so easy to be with. He's fun, he's funny, and he knows so much. You just believe him because he's so credible. And I mean,
Well, when you were
he's
in
done
there-
his research.
When you were in there getting the procedure done, how did it make you feel, and how were you treated as a patient? Give us that experience.
Okay, the entire office, and I don't know, you say 6 people work there. Everybody knew exactly what was happening to me. Everybody knew where I was, what I needed to do, and okay, what he was talking about, the music, the volume, the experience of watching Dr. Jacobs interact with Danny, the scrub nurse, I felt so completely confident and comfortable, and
You were in safe hands.
it was the whole thing was a very pleasant experience.
And that is key. That is key.
Yeah.
That patient needs to feel very comfortable, especially when they're
And
in that environment.
I did, and I've had procedures done before where I come home and I think, what have I done to myself?
Right.
But this, I felt great and in good hands the whole time.
And you're 60.
So,
That's amazing.
Yeah,
Yeah, it looks amazing.
Amazing.
It was a wonderful experience, and I'm looking forward to having that other one done because
Now I am,
I
too.
know that it's going to help. But what I wanted to say about
Yeah.
the facial the acid peel was that my skin was like a rose petal. The dead petals would come off, and there would be these new emerging,
I like that.
Yeah,
soft petal.
baby
I'm
type
like,
skin.
Oh my gosh! Oh my gosh! It was wonderful, and it was non-invasive, and it was quick, and it was
because you mentioned you went under local and not general, which is amazing. And you said you're doing more surgeries under local now, which is you know, quite nice for people watching right now, because a lot of people are afraid of general.
Well, plus they want to get back to work, they want to get back to the gym, they want to get back to whatever they're doing, and that's what we want to do. We want to focus on what's bothering them, see if that makes sense to do the procedure, and then explain obviously how it works and the risks and complications, because everybody has to know that, because we have to be real, obviously, and then minimize. Our job is to minimize risk and give huge benefits. I mean, that's the whole point.
And can you quickly, you know, I need your questions coming in also, our Facebook viewers. Questions for Trish, questions for the doctor. Just give us some questions here. But I do want to talk about your procedure with Trish, the temple lift. Let's go through what you did, because I've never heard of a temple lift.
Okay, so. He said something to me. You said something to me during surgery about the usefulness of your, was it your index finger, your thumb, or something? You said that is the most important instrument that I have.
Oh.
And so when he was performing the surgery, he was lifting and pulling, and with his might, and he is mighty, and it.
How did you do that? You just cut into how's that procedure done?
Well, I haven't heard of it. You could probably see little scars on me
really
still, like right in here.
It's probably hard to see.
Yeah, it's very hard to see.
I have thin hair anyway, but it was, he shaved a little bit.
Cut along the temple?
Yeah, you cut along the temple behind the hairline so you don't see it, and then you tunnel. So the whole point is to tunnel under. We talked about that before, the tunnel, because it's tight actually. Even though it feels loose, it's tight underneath.
Oh yeah.
And so what I was saying was that a long time ago when I was actually a resident, in surgery, and there was a big room, and there was a lot of surgeons in the room. We're doing general surgery, and the professor, the older guy, was saying, what's the most important instrument in this room? And there was like hundreds of them. Yeah. And we're all like, I'm thinking the retractor, the scissors. And he goes, and he holds up the resident's finger, and he goes, this is the most important instrument in the room. And I'm like, So anyway, I was just sort of recalling that story to her, and how it began about being gentle. You have to get in there and you have to lift, but you have to, if you use your finger, it's soft, right? I mean, you don't have something sharp. So that way you have minimal trauma to the tissue. But so the incision's there, it's tunneled down. So what we want to accomplish, what we did is that she had a little heaviness here. And you can't really, if you do an eyelid lift, that's not going to help that, because it's this dropping. Wow. So they need this. Yeah. Okay. And so instead of doing like a whole forehead lift or whatever, it's just a small procedure under local. It took 45 minutes to an hour, and you tunnel underneath, so you really get a good lift, and it opens up the eye as well as raising the brow. I mean, I've done it on patients who wanted I have some patients different, ethnicities. They want more like an Asian kind of or exotic kind of look, or whatever, or it's just heavy. It depends on the person.
Never knew about that
and you can modify that accordingly, and and it heals really well. And people, when did you think you kind of were ready to?
Yeah, when were you ready with everything combined? You were out and about when?
Well, I'm pretty forgiving of myself usually when I go out, so I did have the peels going, but I'm like, you know what? I really don't care.
No.
I don't care.
So how long
So
was that?
2 weeks, 1 week? Oh, perfect.
Yeah.
Well, Trish, thank you so much.
Thank you for having me.
You were so helpful. That was amazing.
You're the best.
Thank you.
That is
just
so
take
cool.
off your mic.
Oh, yeah, take off your mic. Don't run with that.
Gosh.
Thank you.
All right, that is unbelievable, and I never knew about the temple lift or these smaller procedures, which I think is amazing. So we can do a lot under local anesthesia.
Yep.
I'm getting Facebook questions here. The costs are always a concern. What can we say about that? There's a lot of people interested. Cost is a big factor. I know it varies with everybody. Can you talk a little bit to that?
Well, because it varies on what smaller type of procedure you're talking about. Like somebody just, wants a lip lift, for instance, we can talk about that a little bit.
Oh, yeah, the lip lift.
I think that's like $3,500.
Oh, okay.
In that range, $3,500 to $4,000 range. And then the temple lifts are like for about $4,000.
Okay.
So they're all kind of in that. Honestly, most of them are in that range. If they're going to do a little bit more, kind of sort of this whole area through here, then maybe it's like $7,000.
What's a chemical peel?
If you're doing it with a facelift, it's about $2,000.
Okay.
If you're doing it without, it's about $3,500.
And you all do this in your surgery center anyway, which is less expensive than the hospital.
Right.
I think we should transition a little bit into noses too. We talked,
Okay.
but you, did you want to talk about the
lip
lip lift, which
Yeah.
is another new procedure, you
Yeah.
guys? It's called the lip lift, and I haven't heard of this either. So let's talk about that before.
So a lot of patients will come to me and who are getting a lot of fillers in their lips, but what they're concerned about is the distance from here, the nose to the lip gets longer, and they're saying when I smile, as we age, we don't see the upper teeth as much, and their lips sort of turning in, you know. And so fillers aren't going to help that.
No, it
so,
just makes the lips bigger.
Right. This is a procedure where you make a little incision, like I call like a gull wing, you know, curved under the nose, so it heals great. And you remove some skin. It's a local anesthetic. And then it shortens that distance and rolls the lip up, so you see more lip, which is already there. There's nothing added.
No filler.
And that distance shortens. And I've been measuring people sort of randomly between the ages 30 and say 60, and that distance increases like 30%.
Yeah. Wow.
It's pretty significant. And people, I see now the distance from here to here is like this much. It's like 20 millimeters. And we want it closer to that much, like 15 millimeters. And it's instant gratification. It's local anesthetic. They have no bruising pretty well, a little bit of swelling. And the stitches come out in a week, so they could go back to work in a week.
And a lot of people are just filling the lips, which is the wrong thing to do.
For
Trying to get that same effect, which a lip lift
That's the only thing that will do that is a lip lift, and people love it. And it lasts years, and it looks natural.
That's really And real quick before we leave faces, hair restoration. I'm getting questions about hair restoration, men and women. That's huge.
So we do the NeoGraft system, which is it's a non-surgical FUE follicle unit technique, meaning you take out one hair at a time or follicle unit, and then you transplant one at a time.
Wow.
I haven't had it done because I don't have hairs to transplant, in case you're wondering, because I know you are. Not you, but I mean, you know. So
you can borrow some of mine.
Yeah, you got great hair. But so, you know, a lot of techniques, and I used to do this years ago, where they make a cut, like a strip method, and then you cut it up and get the grafts. You have a scar, and especially for a lot of guys that have shorter hair now. Yeah. You'll always see the scars. And I have guys men who will have had that, and then once they hear about this, they're like, I'm not going back. Because you're taking out the hair at the back, but it's like a mini drill with a suction. You're taking one graft at a one.
Wow.
It's very painstaking. We have these amazing hair technicians that work with us, and then one at a time it's put back. At the right angle, too, because it's not just about how close they are together, the density, which is important, but what angle, because you want to, if there's no hair already there, you want to make sure what hair you're putting would have been that angle. So when it grows out like regular hair, it's going to fall a certain way, comb it, style it. So, and it's permanent. Well, the average person is getting, for males, are getting 2,500 grafts.
Wow.
And that takes, that's a 9 to 5. Okay. But it's one time.
Oh, that's good.
Done.
Okay.
And then, you know, I call it like planting seeds. You got to plant your seed to harvest next season. So it takes months to grow, but they just go back to work. I had a pilot from United. He was doing flights to Asia 5 days later. So you can work out the next day,
that's
2 days later. So that's pretty cool.
You're flying to Asia with more hair. I like that. All right. Do you want to transition into noses? Is
Sure.
there anything else you want to say on faces before we leave faces?
I think we're good.
Okay, good. And remember, thejacobcenter.com, you can see all the before and after pictures. If you have missed any of this conversation, just go to KRON4.com. And I'm going to give the phone number. Do you want to do a second Botox?
Why don't we wait a few minutes?
Let's wait a few minutes. We might be giving away more Botox. We're going to make you wait a few minutes. We want more questions from our Facebook viewers. Anything. Faces, noses. I'm getting a lot of body questions, too, so we might have to bring Dr. Culbertson in a little.
Yep,
and,
we'll definitely bring Dr.
So I'm getting
Culbertson.
your questions about the body and everything. I'm waiting on those, so don't think we're not listening to you.
A little bit later, Dr. Culbertson is going to talk about breast and body surgery. Yeah, breast augmentation, Brazilian butt lift, whatever.
Yeah. All right, so let's talk about noses. Let's talk about rhinoplasty, what's new in rhinoplasty, and...
so the key again, it's the bottom line is always about looking natural. We talked about balancing the face before. So if you study somebody's face as an aesthetic surgeon, you want to say, okay, well, how do we want to change the nose? Patients, of course, most of them have an idea what they want,
right?
But they're not, they don't know that, because what happens is that if you change, say, the tip of somebody's nose, it affects the top, it affects the nostrils. Everything is balanced. So if you change one thing, another thing's affected. So again, if somebody has sort of a bump on their nose, you can't just take the bump off, because the nose will look like it's sticking out. It's sticking out. You've got to then bring it in, and you have to show that. So I have this computer imager. So we take a picture, show them on the computer what they could look like with surgery as a suggestion. So computer imaging for rhinoplasty is just amazing, because you can, especially in a profile, you can really see, and then you could say, well, see, if we do this, what do you think now? And you bring them into the process, right? You bring them into how, and I tell them if you like it or not. I mean, it's part of that give and take. So they feel like, and they are, part of the process.
I'm getting a Facebook question about that, about the consultation and how you can see a picture of yourself. So is that part of the consultation?
Absolutely.
Will you show them what they're going to look like?
Yep, it's absolutely part of the consultation. And
I love that.
Yeah, and I say, look, don't worry, take your cell phone and take a picture of the screen.
Yeah.
So you can go home with it and not like we're hiding it. You're going to take it home and then think about it. And if a lot of patients, or not, but a number of patients will come back and say, you know what, can I just talk to you a little bit more? I'm not quite sure about blah, blah, blah. And then sure, we come back, we do like a quick second consultation to just, kind of tighten things down. And then if they do want a procedure like anybody, they actually come a few weeks before surgery, what we call the pre-op visit, so that we talk about everything again, sign the consent, give them medication, prescriptions, whatever. So we're always on the same page.
They know what's going to happen when they come in for that procedure.
Right. And what I do actually is that the night before surgery, I take everybody's charts home and I have drawings, I have all their pictures, and I make drawings and things. And then I figured, okay, now we talked about this, I told them that, I got this picture, but what is really my sort of battle plan? And then I make all these drawings of, say, noses or faces, and then I give it to Danny, my nurse, and she puts them up on the wall, right, in the OR. So we know exactly what we're going to do. But surgery is one of those things like, playing football. You got to call cadences sometimes. You got to go with the D. So it's like, okay, well, you did that, but maybe, that's not exactly quite, maybe I should do something different. So there's a lot of that, when I think you've done a lot of surgery, the technical part, is pretty good at. But what I spend most of my time with is the creative part.
The artistry.
You put in a stitch here, does that look right? If you lift this a little bit, and you look at different angles. We sit them up when they're sleeping, because people say, well, how do you know when I'm lying down what my face looks like? Well, it's because you're sleeping. You lift you up. Because the beds do these things. So you want to go around the table. You want to look at different angles. You want to really get a sense of three-dimensionally what's going on. So, and rhinoplasty is totally three-dimensional. In fact, I don't know if somebody wants to bring me those masks. They're in the box. But I also was asked to give a talk on how, when you lift the nose of somebody, especially a female patient, how does that change the look of their face? Yeah. That we call this the nasolabial angle. Well, I was asked to give a talk at a rhinoplasty meeting, and I decided instead of taking pictures, just photographs, I would make masks of people's faces. So actually, I brought a few masks. I don't know if we have them here, to kind of show patients three-dimensionally what actually happens in faces, because it's 3D. So it's all of this helps us understand, and the patient, what they're going to get into. What's really going to happen with their nose. And
let's talk about a normal rhinoplasty. How long does it take? What's the healing process?
So there's a little incision or stitches under the nose here. There's a little plastic cast. The cast and little stitches come out in a week. I don't pack the nose. You can breathe through your nose, a little stuffy.
That's good.
There's some stitches inside, but they dissolve. It's no big deal.
Okay.
And then you may have, you may have some bruising here, or maybe hardly anything. And so that may be an issue, but a lot of my female patients are going back to work 10, 11 days easy.
That's good.
Yeah. So the main thing is you can't do anything. They want to throw the mask to me. Any strenuous.
It's live Facebook, so come on in and bring the mask. What the heck?
Yeah.
All right.
Do you have the other one?
Dr. Culbertson, by the way.
Well, it's just that this is the one in surgery.
And we've got a real person, too. Jennifer's going to come in.
Yeah, yeah. Well, Jennifer's
remember, you can see everything on the jacobcenter.com, KRON4.com for this if you missed part of it, and 415-433-0303 is the office number. Just letting you know. Bring your questions, and I know I'm getting a lot of questions, too, but real quick, I just want to answer this, and this was face. Can fillers help to define your jawline? We forgot about that. I forgot about this question.
Yeah. So, I mean, fillers, we do have a nurse actually who's great, Lisa Bryant. She does a lot of our fillers, and some of Dr. Culbertson. But, yeah, it depends on obviously what's going on. If you just have like a little, some people have like a little notch or indentation, a little sagging. Yeah, you can make a little bit kind of more definition of the jawline.
Okay. Yeah. All right. I just wanted to get that question. And another one, if this person lives in Sonoma or North Bay, where do they go for a consult? Wouldn't that be Healdsburg? Okay.
Yeah, you can go to Healdsburg for the consult. Yeah. So you can go either place.
And just go to the jacobcenter.com, and that'll give you all the information of where you need to go and what you need to call. Do you want to show some before and after pictures?
Yeah, why don't we'll wait on hers.
Okay.
Yeah, so here's a nice looking gal. She had a bump on her nose, was sort of sticking out a little bit. The angle at the bottom here wasn't ideal. So we, as you can see, we got rid of the bump.
Very nice.
Lifted the tip, but at that distance, you probably can't tell that really great, but it's on our website. But again, a lot of refinement here about this angle here and the actual way the nerve curves up and a little bit of a little slight dip here. These are all little things that rhinoplasty is a surgery of millimeters.
Yeah, that's what I would think.
It's millimeters, so slight changes make a big difference.
It does, because a little bit, like you see some people that have had nose jobs, and it doesn't make them look better.
Right.
What's going on there?
Well, I do a lot of revisions, actually, and that's because if somebody just took the bump off and didn't see, or if they made the tip smaller, but the nostrils were sticking out and they weren't brought in, because you look at the base of the nose, it looks like a triangle.
Yeah.
At first it looks like this, but then it looks like this. Well, you want to get that proportioned. And there's a lot of telltale signs that the person who's not a surgeon can say, well, it just doesn't look right. Of course, we know what happened.
Yeah.
So and the other part that's very important for listeners or viewers, I'm sorry, is the structure and function of the nose. So everybody, of course, wants to look better.
Oh, absolutely,
but, you know, I'm also board certified in facial plastic, but ear, nose, and throat. So breathing through the nose is key.
Exactly.
You don't want to have a good-looking nose and not breathe. You know, it's like having a Ferrari with a poor engine. You know, you want to
have a hockey team with no good hockey players.
Yeah, yeah, just look good-looking guys.
I got to
with
put
a
it
few
back to
teeth
hockey.
missing.
Yeah.
But sorry, Brent. But I love Brent Burns. But no, the idea is that, you know, the functioning of the nose is important. So there's an area here called the nasal valve. So if you're just going to try to narrow too much and it gets collapsed, then you're going to be like, you know, I can't breathe.
Can't breathe.
So we want to structure rhinoplasty is very important. So I go into that a lot with patients. How do we keep their breathing better? In fact, if somebody has trouble, how do we make it better even? And that's really
true.
important.
A lot of people come into you with breathing problems
some
and just
do.
need
Some do.
But will you do revisions?
Yeah,
Okay,
I do
so you're
revision
okay on
rhinoplasties.
revision?
Yeah.
Facial and nose
Facial
too?
and noses, yeah. In fact, yesterday I saw a lady who had a facelift and a rhinoplasty. Both needed some work.
Really? Okay.
So yeah,
Okay.
it depends on the person.
Do you want to bring the live before and after in? 'Cause
Sure.
Those are always exciting.
All right. Let's bring in Jennifer.
We're going to bring in Jennifer. Jennifer is a patient of Dr. Jacobs. And remember, thejacobscenter.com, KRON4.com to see what you've missed here. And also the number again, 415-433-0303. Jennifer, hello there.
Hey.
We're just going to fix your mic a little bit. Renz, thank you. Thought you had it right?
Yeah, that's right.
You know.
Yeah, he's the pro.
Thank you.
Well,
All right.
good to see you.
Great seeing you,
How are
doctor.
you?
I'm doing great.
Good. Well,
Doing
thank you for
great.
coming. Of
Of
course.
course.
Yeah, yeah.
Of
Jennifer's
course.
an awesome patient, and she lives. You work in San Francisco.
I do, yeah.
And you have a spa, or is it?
Yeah, I'm an esthetician
Yeah.
on Union Street.
Oh, okay.
And
Okay.
so-
And so you decided you needed a rhinoplasty.
I have been thinking about it for years. Since I was
Really?
a child, I was very insecure about my nose.
Really?
I had a large bump
Uh-huh.
in it, and so
This is your
especially
before and after, right?
when
This
it
is
came to profiling, I was,
Oh, yeah, yeah.
you know,
So
for people to see
you
inside.
were bothered by it for a long time.
For a very
ever
long
since you were
time, yes.
And a lot of people watching right now have that same thing. And what should I do?
Yeah.
And if I do it wrong, it's going to mess the whole thing up. So
Exactly.
it's a huge decision,
Exactly.
right? And you've been thinking
Yeah.
about it.
I was
since
thinking
you're-
since childhood.
and it bothers you,
It did, and I was always too scared to do it because I was worried I wasn't going to look like myself.
right?
Or it was going to be done incorrectly. You know, you hear horror
Yeah.
stories.
Who do I go to? It's so
exactly.
overwhelming out there for people too. You watching right now, which is great. It's so overwhelming. Who do I go to? Who can I trust to
Yes.
do it right? Correct. So that's
Exactly.
Absolutely, you nailed it.
Exactly. And so I did lots of research. I
Oh,
went
okay.
and I visited a few offices, and I wasn't sure, you know, going to the doctor's office was an experience I had never encountered.
really.
It was very comfortable in there. And the 3D picture or
Oh,
the 2D
yeah.
picture that he showed me
Yeah.
made me feel very confident in what I was going to see, along with like seeing other clients in his book, because you know he has like
Right.
a picture book.
Right.
And then he walked me through the whole process.
Really. Oh, that's good.
The day that we met. So I was really confident.
And did he say he was going to do, I'll get to how you did in a minute, but did he tell you that, because you just wanted the bump off,
Yeah.
did he say, okay, we need to do the bump, but we need to also do this
He
to
sure
balance
did.
it out?
And
Really?
I
And that
was
made you feel
so
good?
unaware, yeah. Just
Oh,
of all
yeah.
the little things that were involved.
Yeah.
And so
You just thought the bump was going to come off and that would be
that was it. Also, and I told him, you know, I didn't want to look like somebody else. I wanted
Yeah.
to look like myself. And often now when people see me, I talk to my clients all the time
Yeah.
about it. I'm so proud, actually.
And a lot of people think it's no big deal, but
Yeah.
did it affect how you worked, how you were with people, how
Definitely.
your social experience? It affected you
Always.
because you'd always be thinking about
Always.
it, right?
I feel beautiful now.
Oh,
I'm
I
so
love that.
confident. I am so confident.
That's
so,
fantastic.
It just made a big, and I regret not doing it sooner. But
Oh,
I'm happy,
yeah.
you know,
You're
maybe
yeah.
it took the time to find you, doctor.
So tell me what you did to Jennifer. How did that happen? What'd you do?
So yeah, so for Jennifer, like she said, she had a bump, and the bottom part here was a little bit lower. So what was important is that when we talked about the imager and just examining her and kind of feeling the nose and all, is okay, we'll make this smoother, but also to make it look very natural, because if you take up too much here too, it also looks a little kind of scooped sometimes. It looks a little, you know, overly done. And also we wanted to raise the tip a little bit because it was kind of hanging down a bit. So we raised the bottom part here and also made the tip a little bit smaller. Because again, if you take the bump down and you don't address the tip, then all you're kind of looking at is the tip and it just doesn't look right. So all these little things, and again, we're talking about millimeter changes. We're done in the, she had a little incision here, which again, we use to lift the skin up so we can do the work and put it down. So all they see later usually is this little bit here. If they need nostril surgery then to narrow it, then there's a few stitches here and here, but that heals really well. Most people don't have really much pain with it.
I was never in pain.
Under local?
No, you have to be
Do
asleep.
you have to be general?
Rhinoplasty is
Okay.
asleep.
Okay.
Yeah, I was under general. I was never in pain, even after the procedure.
Really?
I was never uncomfortable.
And what was the recovery like? Tell me about the process of recovery, bruising, all that.
Yeah, I was definitely bruised, but I feel like very minimally. Right afterwards, we went to the rotunda. Like,
Oh, you did?
I was like,
With your bandage
with
on?
my
and stuff?
I was proud. I was so proud.
Badge
He
of
took
honor.
it. Well, I guess not that day. I should say after I had the cast removed. But,
Oh, okay, yeah.
You know, when I was, but I was never in pain. No.
Really?
I was very comfortable.
And since you saw the 2D imaging and everything, and you got the whole explanation, was it scary when you were taking off the bandages? I mean, or did you pretty much, you felt comfortable?
I felt very comfortable.
Yeah, you knew what was going to happen.
Yeah, I mean, I was so unhappy with what I had before as well, and I was so confident with his skills and seeing previous clients that I was not scared to see what was beneath.
A lot of people think it's a vanity thing, and it's like, no, it's not, because it really does affect you in all aspects of life, right?
It really
Work,
does.
relationships, everything.
Your confidence.
And yeah.
I have people who tell me, you know, they pull up to a stop sign and they're kind of like doing this.
I do.
Yes,
I do
exactly. Because
that.
that's all you think about is they're looking at my nose,
yeah.
they're talking about my nose. So tell me how life is different now.
Life, I don't do that. I was definitely one of those people who, from the side, I may have kind of done that, and I don't mind taking pictures from different angles now.
Wow, that's huge too.
I feel like it looks good in all angles now.
And you don't spend, what, 95% of your time thinking about your nose anymore.
Never.
Which is huge.
Yeah. I love what I see in the mirror.
And how was your experience with the team? Dr. Jacobs' team?
Amazing. When I got there, I was obviously very nervous, but I got to meet everyone. I felt like I built a small relationship with Hillary. She's there. And then the anesthesiologist, he was amazing.
Did you all go to the rotunda afterwards?
I wish.
We went to a restaurant in Healdsburg.
Right. Yeah, we did. That was lovely as well.
How'd they make you feel when you were actually in there? Before, you know, because a lot of people get nervous before the procedure. How did they make you feel
it
before?
was so comfortable. There's actually a room to the side that you get to sit in. There's magazines, a very comfortable chair that you get to just kind of chill out for a second. He showed me the room that I'd be in, very sterile, very clean. And so by the time the medication was doing its job,
you were ready.
I was ready to go.
great.
And I was, again, very comfortable. I was laying there and I was
And much better being in that room than a hospital.
Yeah, it felt like a spa.
Yeah.
You know, in a way. And the facility
That's true.
itself is very nicely designed.
Fantastic. We're
Cool.
going to
Well,
wrap,
thank you.
Jennifer. Thank you
Yes,
so
of
much for
course.
coming in. That is amazing.
My pleasure. Thank
Yeah,
you for
that's
everything,
great.
doctor.
Thank you.
We'll head to the rotunda soon.
Yeah, right.
Celebrate your
so
nose.
fancy.
Jennifer, thank you so
Thanks,
much.
Jennifer. All right, bye-bye.
All right, just let me, if you want to see before and after pictures, thejacobscenter.com, KRON4.com if you missed any part of this conversation.
Botox.
And, oh, you want to do the Botox? We can do the Botox offer now. Also, first 3 callers to this number, 415-433-0303. First 3 callers, a syringe of Botox.
Yep. And that's like, that's worth like $350.
That is. And
then
let's wrap up noses and bring Dr. Culbertson in, too.
I think that's a good time.
But anything you want to say about noses? Or are there anything we should know new in the nose rhinoplasty?
Well, I think this is worth showing. This is a lady who, you know, a lot of people think, well, you know, a lot of my patients are like Jennifer, young gals, but you know, they're patients who are a little bit older that have never liked their noses, and you can see this has made a nice difference in her.
Very much so.
And so, or that other blonde lady I showed when I did the facelift with. So it's not like you have to do, you know, when you're 20, now I'm past 40 or 50 and it's too late. You can still do it. It heals great. You still are happy. People are happy with the results, obviously. So it's not something you just for young people either.
Gotcha.
And I do a lot of males too. And you know, I have
Men,
questions
women.
that are asking about I don't want to lose my ethnicity completely, whether they're Middle Eastern or whatever, Hispanic or whatever. And and I'm like, yeah, I get it. So I get people with really kind of prominent bumps, but again, we just take it down a bit maybe and just leave a slight, you know, kind of elevation. So it doesn't change them completely.
Gotcha.
It just looks like that's the nose they were kind of born with.
Gotcha. Yeah,
You know,
exactly.
that's really
They
key.
still look like
They
themselves.
still look like themselves.
Do you
Yeah.
want to touch on prices at all?
The prices for rhinoplasty, non-revision, so more straightforward, like Jennifer's, range from sort of $7,000 to $10,000. That includes
included.
anesthesia,
Okay.
and then a little bit more if it's a complicated revision case.
Well, let's bring Dr. Eric Culbertson in.
Yeah, come on in,
And you
Eric.
can explain to our viewers on Facebook who have questions. They need to write them in right now because we've got now we're opening up face, nose, body, everything. All the questions, you guys. So bring them on.
So
we've got 'em
Dr.
here.
Eric Culbertson has been a great addition to the practice last coming up to 3 years, and he's a board-certified plastic surgeon, fellowship trained. Did actually his internship at UCSF, so he knows the Bay Area as well. His brother lives here, so it's cool. He's got a lot of connections here.
Where's your brother live?
It is right in the city.
Oh, hi. We just want to wave to your brother. Okay.
and so, it's been a great addition because as a facial surgeon, we were not doing from here down. And so having somebody who specializes in that's been a really great addition. And he's doing all the way from breast augmentation to Brazilian butt lifts to breast reduction, liposuction, tummy tuck, etc. So he's been a really, and in fact, we have a number of patients that we've done and continue to do at the same time. Like I can do a rhinoplasty and he'll do a breast augmentation in one
so
sitting.
you guys will do it together.
Yeah, or you'll do like an arm lift and I'll do a facelift or whatever. So if it's safe and the time allows, then we have this conversation. We discuss it to the patient if it's possible. We talked to a patient yesterday who wants a breast reduction but also wants a facelift. So we're saying, well, we'll talk more about that. So
I like that.
So we can do that as well. So here.
Well, I think one of the important themes that the audience has been hearing through this whole time is that we really emphasize the individual patient safety, as he just mentioned.
Absolutely.
And that's one of the things in the nearly 3 years that I've been working together with Dr. Jacobs now, that we both really are very patient focused.
Right.
We don't run a factory where we just crank out the same surgery on every patient.
Gotcha.
We treat everyone differently. We guide them through the process beforehand, through the recovery period. Every patient that we operate on gets our personal cell phone numbers in case they need to reach us after hours.
That's
have any
huge.
Questions.
Yeah, because people
really
had surgery,
huge.
they're worried. Like if I was a patient, I had surgery, and be like, I'm sitting at home on a Saturday. I don't know what's going on. Is this normal? They should text us.
It makes them feel so much better when they can get you on a text or the phone and actually, oh gosh, the swelling is normal. That's normal. It makes them feel so much better coming from you, actually.
And in technology today, they text us pictures.
Exactly.
Or FaceTime.
Yep, exactly.
And I used to be mountain biking and be like, oh, now I have to meet you at the office. Be like, oh God, and we get there, oh, you're fine.
We're playing hockey.
We're playing hockey.
Well, he's a soccer player. He's a
soccer, hockey, we got it all. If you have questions for soccer, hockey, bring them in. I have a couple questions, Dr. Culbertson. Facebook questions, and remember, bring those questions in. Are there weight limits when it comes to BBL or tummy tuck?
That's a great question. Of course, as we said, safety is both of our #1 priorities. It's really, the key factor is really something called the BMI. So it's not just what your weight is, but it's relative to your height. If you're taller, if you're shorter, obviously you can be a little bit heavier, a little bit lighter.
That's the body mass index.
So that's the
BMI, body mass index.
It's kind of that ratio of your height to your weight.
Gotcha.
And that definitely plays a role. We'll talk about that through the preoperative period. Sometimes patients, they would get a great result, but they really do need to lose a little bit of weight first. And especially for body contouring procedures, that can be very important, not just for safety, but for getting the optimal outcome, the optimal result.
Do you want them to gain a little weight if they're going to do the, the fat transfer for the Brazilian butt lift, which is very popular right now? Do they need to gain a little weight so they have some fat?
That is a fantastic question. There are many surgeons who do fat grafting, the BBL, who encourage their patients to gain weight ahead of time. I'm very cautious about that. There are advantages to that. I don't actively encourage patients to gain a lot of weight unless they are planning to maintain a heavier weight. Because the problem is, yes, you can maybe transfer the fat a little bit easier, but once they lose that weight back afterward, it's going to go away.
And what about skin loosening and things like that? You might have to worry about that kind of thing.
Can happen as well.
Save the weight gain for a movie role, right? I have a lip fat transfer that I forgot to give you. Do you do lip fat transfers?
I used to do quite a bit of those a long time ago, but I don't do much anymore. Honestly, because fillers are so easy to get a hold of. They're,
yes, okay.
You know, pull it out of a shell. You don't have to take fat, and it's reliable, and it's smooth. Fat can be a little bumpy.
Gotcha.
And so I think you're better off with fillers, don't you think?
I very much agree.
Yeah.
All right, Dr. Culbertson, Facebook question, what is the mommy makeover? When should I get it? Can I be too old to have it?
That is
Facebook
another great question. So
in.
the classic mommy makeover basically corrects the changes that are common after pregnancy, which is to restore the shape and volume of the breasts, and also to reshape the abdomen, which tends to get stretched out. The rectus muscles tend to get splayed apart, and those are kind of the key things that we correct with that procedure.
Okay.
It has kind of evolved really to be anything you want it to be at this point. It can be a labiaplasty, it can be just liposuction and treating the breast, or the tummy and liposuction. But basically whatever it is for each individual patient to make them feel like they're back to the body that they had before they had kids.
And another question is, how long are you out with a tummy tuck, that kind of thing? How long are you out? Give us the, you know.
Yeah, so
the lowdown.
Yeah, the lowdown.
The lowdown on the tummy tuck. So the toughest part of the recovery is that first week where you really do need help at home. I encourage patients, even after a tummy tuck, to be up and walking even the night of surgery. It's very important for feeling better, trying to get back to that normal lifestyle afterward, but of course you're going to be taking it easy. You're not going to be running laps around the house for a while. But you can start to transition doing a little bit more at 2 weeks, maybe some light exercise at 4 weeks, but it's going to be a good 6 weeks before you can really start getting to a full workout.
I have another Facebook question about Brazilian butt lifts. We kind of touched on it a little, but this question is interesting. Are there any long-term issues with the Brazilian butt lift?
There can be. So my preference when I'm treating a patient, when I'm adding volume to the buttocks, is to add volume and shape. I'm not necessarily, in the vast majority of my patients, trying to achieve the Kim Kardashian look.
Right.
It might look great for that person right after surgery, but gravity and age do take their toll, and if you put a lot of fat there, it may not look so great 20 years down the road.
Yeah, and implants, are they an issue right now? Nobody's using butt implants,
I'm not a fan of butt implants. I love fat grafting. It works great. Implants work great in the breast, but we don't sit on our breasts all day long.
Yeah, that's true.
That's the problem
That's
with
true.
implants.
Try not to.
There's an interesting hydration. What's the best treatment for hydrating the skin from the inside out? Maybe both of you can touch on this. I've never heard that question. Hydrating the skin inside and out.
Well, it's actually pretty straightforward. The inside would just drink. You need to drink a lot of water.
Okay.
I mean, I think a lot of people are probably dehydrated most of the time. You're sitting in office, you're exercising, you don't drink enough water. So definitely hydration by just drinking water is key. You can even see your skin feel better, you know, with that. But from the outside part, we call it transepidermal water loss, which is a term that we test to see. There's machines that tell you how your skin is in terms of water hydration. But from the outside, a great moisturizer basically is what you need.
Oh, okay.
We actually developed a few products, Stanley Jacobs line, more focused on skin elasticity. But we do have a moisturizer that does plump and hydrate the skin. But there are a lot of good products out there. I think that's the important thing, is to make sure. And of course, sunscreen.
Oh, sunscreen.
Because sun and wind is going to, especially, you know, we've had the fires up where we are, and we're talking to patients. In fact, we had a little event called Mind, Body, Soul that some local people put on to help, you know, after the fires. They were planning it anyway, but we were actually giving out our serum because you know, the skin was taking some toll from that wind and the soot and things and pollutants. So yeah, you obviously want to use a good cleanser, but you want to use something that will actually plump and hydrate your skin. But yes, absolutely hydrate by water intake.
We only have a few minutes left, sorry to say, but I want to, do you do revisions also, Dr. Culbertson?
Oh, absolutely. Breasts, tummy tucks, liposuction.
Because a lot of people have gotten surgeries and they haven't worked out, and so a lot of people need somebody they can trust to go to for those revision surgeries, and so that's good to know you both do them.
And then tell them about that 3D imager thing.
Oh, yeah.
Yeah, so speaking of breast surgery, one tool that's been really helpful for me in guiding patients through the process of breast surgery, especially breast implants, is 3D imaging. It's, you know, in the past, you would take an implant and maybe stuff it in a bra and kind of say, well, this is about what you look like. But
doesn't work.
It's terrible. It doesn't look anything like what it's going to look when it's under the natural living tissue.
Exactly.
So I use a tool that takes a three-dimensional scan of each patient, of their body, and I can simulate different sizes,
Oh,
different
that's good.
styles of implants, and give them an idea on their own body what it's going to actually look like, what they might expect after
Very
surgery.
cool. I've seen it. It's pretty
Yeah.
amazing. And then you can put on these VR goggles and you look
Oh,
around and go,
really?
And see it in
That's
3D.
me.
That's me. You can
Yeah.
touch your own self.
Yeah.
I like that. Or,
Yeah.
you know.
Whatever. But yeah, you really
That's
get a sense.
interesting.
Yeah, it's very cool. Yeah, I've seen them doing it. It's awesome, and that
Oh, I
really
like
is
that.
unparalleled. Or they used to put like rice or something.
Bags of rice
Oh,
to
yeah.
try to figure out.
Yeah.
Oh, yeah,
yeah,
yeah.
that's-
No, that
yeah.
stuff doesn't work. So
No.
the 3D imaging, that's
Yeah.
amazing.
Yeah, you could push a button, right, and it says 365cc implant or whatever, and you're like,
And
oh,
it'll pop up. Oh, that's
Yep, and I can share
interesting.
the images with the patients so that they can, at home, they can look through them. They can even show them to their friends or
Oh, that's
significant
great.
other, and helps kind of let them know what to expect.
And you're the same with consultation as Dr. Jacobs is. People are interested. Same thing.
And also, our consultations are free. We don't charge.
Oh, okay, good. Free
Yeah,
consultations.
they have to give a credit card, obviously, just to secure the time, because if there's a no-show. But otherwise, there's no fee.
And let's just talk real quick. We only have a few minutes left about the locations again.
So Union Square, San Francisco, 166 Geary. So we're right across from Neiman Marcus, and that's where we do consultations, imaging, Botox, fillers, takeout stitches, post-op, pre-op. And then our surgery center's in Healdsburg, which is not destroyed by the fire. It looks great. Everything's fine. Business as usual, and we have a big accredited facility there, and we keep them overnight to recover.
And real quick, what's your favorite surgery to do?
I love fat grafting, but in a natural way.
Yours?
Nose.
Nose. I love it. That's so cool. All right, real quick, jacobcenter.com, KRON4.com if you missed any of the conversation. And the number again is 415-433-0303. I'm pretty sure we've got the Botox gone. So, but, you know,
Bye-bye, Botox.
bye-bye Botox, but that was good. All right, well, thank you so much.
Thank you.
Thank
and
you.
thanks for doing it, Janelle. This has been great.
This has been a lot of fun. We could
Thank
talk
you.
all day. We're going to have
Thanks
to
to
bring you guys
Jennifer
back in, talk more about more surgeries.
Yeah, well, and you know, you got to stay tuned. If we come back, hopefully what are we going to give away next time?
That's right. What are they going to give away next time? You never know.
And I do want to thank everybody at KRON for making this happen. This
Yes.
has been a really great experience.
Yeah.
And Brian
Especially
and
our
Mindy.
patients for coming.
Yes, our
in.
patients,
Yep.
Trish and Jennifer. Thank you
Trish and
so
Jennifer.
much.
So it's been a great experience.
Yeah,
Thank you.
You guys can come in and come around the back while we wave, because even if they cut us off, just come on. Even if they cut us off, we're still going to be on, I hope. Yeah, thank you for joining the KRON4 Web Chats, and we're going to have a lot more, so we'll see you on the next one. But thank you so much, everybody, for coming
on in.
in.
Bring it in
Thank you.
close.
Oh, bring it in close. Thank you. Bye, everybody.
Bye.
Bye.
Pretend like you're talking.
Oh, okay, okay.